Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain-Free with Dr. Marc Darrow from the Joint Rehab and Sports Medical Center in West Los Angeles. This is the program that can give you effective solutions for the pain that you've been living with. Dr. Darrow is a medical doctor board certified through his studies at UCLA, and Dr. Darrow uses stem cell and platelet-rich plasma therapy to heal your body. He teaches about the use of stem cells, PRP, and prolotherapy. Today's program could open up a new life without pain for you. To speak with Dr. Darrow, call 866-870-KRLA. That's 866-870-5752. Ask for a copy of Dr. Darrow's book, Stem Cell and Platelet Therapy. Now, here's Dr. Darrow with his co-host, Nita Valens.
Hi there, Dr. Darrow.
Hola, ¿qué tal?
Just fine. Great. How are you?
I'm living it up.
Well, this is good. And what will we do with our people in pain that call in to help them live it up today?
Well, the first thing we do is give out our phone number so they can call us.
Okay, I'm in.
We're going to deal with healing your pain, your musculoskeletal pain. And probably half the people that you know, including half of you listening, have pain. And I'm talking in this case about musculoskeletal pain. That means your tendons, your ligaments, your bones, your joints, things like arthritis, neck pain, back pain, joint pain, in toes, fingers, wrists, elbows, shoulders, knees, back. Yeah, we get tons of back pain. So give us a call. We can describe how we use regenerative medicine, which is stem cells and platelets from your body to help heal these areas instead of you having to get a surgery like I did, which failed. So I know a lot of you listening have had failed surgeries too. So the phone number, you ready? Get a pencil and write it down. If you're driving and you want to call in, pull off to the side of the road and please get off of your Bluetooth so everybody can hear you. And the phone number to the studio right now is 866-870-5752. I'm going to repeat it. You ready? 866-870-5752. I'm going to give you another phone number, which is to the office, and that phone number is 800-300-9300, 800-300-9300. There are people there. My staff can give you a free phone consult, and we're introducing Dr. Thomas Grove, who is an amazing doctor. If you look up on my website, you'll see a video of him on the first page, which is www.jointrehab.com. And jointrehab.com, that website has a spot on every single page for you to email me, and I will get back to you the same day. I'm going to I'm going to mail to you a free copy of my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It's a book that has a couple hundred pages on regenerative medicine, stem cells, and platelets, and about 250 studies, actual scientific studies, on how these procedures actually work scientifically and why surgery is no longer a very good option because of the terrible side effects that come with it. I'm not saying surgery should never be done, because there are cases, and the typical one, if you break a bone, you need to see a surgeon right away and see what's going on. And you may need surgery right away to put it back together. But most of these orthopedic surgeries today, in my humble opinion, should not be done. And that's not a statement against the surgeons. I love surgeons. They are probably the hardest working doctors in medicine. A lot of stress. And unfortunately, they hurt a lot of people. And I was one of them. As my listeners know, I had a shoulder surgery, I think it was 1994. I was doing orthopedic surgery. with my boss in training, and I hurt my shoulder doing bench presses with a wide grip, so I'd get the lateral pectoralis muscle hypertrophied, and my shoulder went out. Terrible pain. I had a couple of steroid shots, cortisone, because I didn't know any better back then. Now I know that cortisone is deleterious to your tissue. It can actually cause arthritis and cause tendon tears, things like that. If you want to check me out about that, look at Google, Google. Type in cortisone and type in cartilage, those two words. And you're going to find out it is not a good thing, that it actually causes arthritis if done in the joints. If it's done anywhere else, still not a great idea. So I'm going to go to some questions until we get some callers here. So this one says, torn meniscus. I have a torn meniscus and 50% cartilage wear in the same knee. My orthopedic surgeon advised me to lose weight, that's always a good thing for all of us, and take anti-inflammatory medications. That's a bad thing for anybody. When you're taking anti-inflammatory medication, what is happening is you are blocking the inflammation that helps the body naturally heal. Okay? Let that sink into your head. Feels good for a while, but in the long term you create damage. So the orthopedic surgeon said repairing my meniscus would not solve my problem with my knee. I never had any pain in my knee until I tore the meniscus. I think I need to repair my meniscus. Well, the best way to repair it is what I did with my knee, which is to inject it with stem cells. I had meniscal tears in both my knees, and if you want to look up meniscal tears, you'll see that most aging athletes have meniscal tears. That doesn't mean they have pain. Be very careful to distinguish between having pain and having some kind of abnormality and the thought of having surgery to fix it. Because what we find is most of our patients that come in who have had a surgery have had a failed surgery. That means it did not work or it made them worse. So why someone is going to get a surgery when they can do a simple injection with cells from their own body, from their blood, from their bone marrow, from other things, stem cells or platelets, and actually heal the area up. I have no more knee pain, and I run in the mountains with my husky dog, Bella. Unfortunately, Dakota said goodbye in August. I used to run them together. I'd hook their collars together, but Dakota is in the puppy happy hunting ground now. God bless him. So be careful. Don't get a surgery when you don't need a surgery. You can use regenerative medicine very simply, very easily. You walk into the office, you get injected, and you walk out. Need anything to say about that?
Oh, yeah, because twice you have worked on me and kept me out of surgery, my neck, shoulder area. I had a lot to say about it.
That's a good thing that you're talking about it, because I remember when you came in. Yeah, it was scary for you, but it wasn't scary for me because I knew you were going to heal.
Well, see, this is the thing, is we're educating people, because this is a new paradigm compared to decades of people just running to surgery for orthopedic issues. So you have to open your mind a little bit. So I had to open my mind.
Yeah, and back in the day when I didn't know about regenerative medicine, because it wasn't really in the forefront of musculoskeletal medicine at that time as it is now, I ran to get a surgery. Yeah. I pushed my boss to do it right away, and my arm ended up full of fluid, and I had probably lymphedema, which is a term of the lymph going back into a limb, typically, from having it cut. Often we see it mostly in cancer patients when they have their lymph nodes taken out. And there's an amazing woman doctor in Santa Monica named Emily Eicher. That's Iker, Emily Eicher, whose entire life is devoted to helping patients with lymphedema. And we just had a little meeting a couple of days ago in my office, and I love the work she does. It's different than the work I do. I mean, she wanted to know if stem cells would help with lymphedema, and I don't know anything about that. I mean, my work is orthopedics and musculoskeletal. So here is a question. Hello, I'd like to schedule an appointment regarding tears in my shoulder. I have recent MRIs. Please call, text, or email. Well, we got a hold of this person, and we're not bothered by the tears because people have tears all the time anywhere in their body, but don't necessarily have pain or need a surgery because of it. And guess who's one of them? Me. My right shoulder has a subscapularis tear, it has a supraspinatus tear, and it has a labral tear. And if you're interested in what these words mean, just type them into Google, and on the upper left-hand corner, there's a spot that you can click on images, and it'll show you pictures of what your pathology is, or what my pathology is. So I'm not worried about when people have tears on their MRI, because the MRI often means nothing. We have to use our hands and move the person around, do a good examination to actually find out where the pain is being generated from. MRIs or X-rays don't tell us where pain is coming from. And studies show that people with terrible MRIs don't necessarily have any pain at all. I've had people come in with 20 pounds of imaging. One guy had to go out to his car to carry it in for him. None of that related to where his pain was. I found his pain by using my hands. Just like my grandfather used to do, who was born before MRIs were invented. He was actually born in the late 1800s, and he was my medical mentor growing up. So he was a natural doc because that's all they had. There wasn't much in the way of medicine. There were no images, and he would use his hands to examine and then treat that way. So I'm going to do another one neat. I'm going to give out the phone number actually first.
Good idea.
The phone number is 866-870-5752 to call me right now at the studio, 866-870-5752. And if you call in now or you call my office, which is a different phone number, that's 800-300-9300. If you call my office, you'll get a free consult on the phone with my staff, and we will send you out a free copy of my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It took me 5 years to write this book, to get all the research together, and it shows why surgery is no longer the answer for most musculoskeletal problems. It is useful in many things, but rotator cuff tears, meniscal tears, labral tears, not in my humble opinion. So I do use an ultrasound to look inside the body instead of an MRI. I mean, if you have an MRI, I want to see it. But often the ultrasound, which can tell us in 1 minute, you don't have to go anywhere, we just take a look inside. And that'll help us diagnose where the issue is. So this next one is on a similar vein, but it's a little more complex. This person wrote, I had failed shoulder surgery. Let me see what that says here. So Dr. Darrow, I had left shoulder surgery after chronic pain, and the pain is worse. That's what we call a failed surgery. You'll hear things like failed back syndrome, but it can be anywhere in the musculoskeletal system where you have a surgery and it didn't work out well. So it's very, very common to have a surgery and come out worse. If you come to my clinic someday, you can talk to the patients. Probably half of them have had a failed surgery already. And if you get a surgery, let's say in your knee, and some of the meniscus is taken out, which never needs to be done, in my opinion, unless it's blocking the movement of the knee. And that's not typically the case. They end up with immediate arthritis. Now, I've heard people say, the surgeon said if I don't get the surgery, I'll end up with arthritis 20 years from now. Well, how about this? You get the surgery and you end up with arthritis immediately. So I don't get it. If the surgeons would read their own journals, they would see that what they're doing, for the most part, in these kind of cases, is not good for patients. I don't understand that. I really don't. And in the orthopedic journals, there's also studies on stem cells and platelets that shows that it works. Are they not reading their own journals? I don't get it. I really don't get it.
I don't get it either.
In medicine, the most important law of medicine is do no harm. What we do rarely causes anybody any harm. The major side effect is getting stiff. After we inject, we create some inflammation, and usually in a day or so, the inflammation is gone. So even though the body is inflamed in that area to begin with, causing the pain, we need to kick up that inflammation a bit more by injecting with stem cells or platelets. I'm going to give out the phone number again. It's 866-870-5752. Give me a call. Let's talk about what your issues are. Anything to say, Nita? Yes, you do. You want to ask me if there's other things we do in the office, and there are.
Yes. How'd you know? You read my mind again.
I know. I'm so good at that.
I know.
We also can inject the stem cells or platelets into the face, and there is a treatment we do called the vampire facelift. Kim Kardashian made that famous because she had it done. And we get just as many men as women who come in for vampire facelifts, and we just inject your own platelets, or it can be your stem cells, to regrow the collagen in your face. So it plumps up the collagen again. It makes you look younger.
Would you like to talk to OC in Los Angeles?
Yeah, OC, just hang. I'm going to go for one more part of this,
okay,
which is these treatments can also be used to stimulate the follicles on the head to regrow hair. So if you're starting to lose your hair, this may be the treatment you have been looking for. So, OC, how are you today, my friend?
Oh, I'm all right. I don't want to call it pain. I'm going to call it discomfort right now. I got the word pain to be seen about psychological warfare. They want you to be under pain so they can treat you or mistreat you. I'm supposed to be getting an injection based on the accident I had July the 5th, and was not a fault. And I had an MIR, now they scheduled me for injection. They recommend an injection for the pain problem that I'm complaining about.
Yep. Where's the pain you have?
In my lower back.
Okay. So what they're probably talking about is doing an epidural. Do you have any pain down your legs?
Yeah, they claimed I had a little problem on my left side. No,
I'm asking if you have pain. Do you have pain in your legs?
Oh, go ahead.
OC?
But this is what I got. I got a little readout that you can help me pronounce some of the words. Just a little short. It's you said a 3D radiograph of lumbar spine obtained today revealed a left lisp with a right thoracobular, THORACCL, a thyroid lumbar.
Yeah, I'm not sure what you're saying, but I got to get to something else that's more important.
It's THORACOCUM.
Thoracic, yeah. The point is that that's not relevant to me. I'm going to go somewhere else. Hey, OC, can you listen for a second? I got information for you, buddy. Do you have pain down your legs?
I'm on the phone handling business.
What's that?
No, so my brother coming to my window while knocking on the door trying to give me a parking spot. All
okay.
Right, go ahead.
OC, the doctor's asking if you have pain down your legs.
No, I did, but I don't have it.
Okay, so that shot in your back called an epidural is not what you want to get. That's cortisone in the low back. It may help you if you have terrible leg pain, but you're not complaining of that. You're complaining of back pain. So for
Right.
back pain, we would use regenerative medicine, and we would stabilize your vertebrae by injecting the ligaments around there and thickening them up. When we inject the ligaments, they actually grow in size and thicken up, and they tighten up. So that's what I would think the treatment would be for you. Okay?
How can I switch it? I hear you. I appreciate you. How can I switch this over from the medical bills and use this as part of the? I have to talk to my lawyers on that to make this part of this lawsuit.
Well, I don't get involved in lawsuits. You have to talk to your lawyer
I know
about
it, but
that.
I have to work that out with your lawyers. I have to ask them that question.
Here's what you do. Get a pencil and paper. Write down my office number. It's 800-300-9300.
9300. I got that in my head.
What's that?
All right, you're not too far from me either.
Okay. Write down this phone number to the office, 800-300-9300, and my staff will give you a free consult on the phone, and you can talk to them about your particular situation, okay?
Okay.
God bless you, my friend. I really appreciate your call. It's been nice talking to you.
Thank you for your call,
And I hope you
OC.
heal up right away.
And the number is 866-870-5752. You can call and speak to Dr. Darrow right here, right now, right here in the studio.
Yes. And if you want to watch videos of me doing these procedures, go to the website, www.jointrehab.com. There's pages and pages of information. I work on that website every day. There's a lot of videos on there. You can see a video of Dr. Thomas Grove, who is a great injector who's doing my injections for me now. And he played linebacker for the Huskers. So he's a big boy, and he's kind of busting out of his clothes with muscles. And he's fun to talk to, so you'll enjoy him.
That's cool.
All right, let me go to another question here, Anita, if you don't mind.
Sure.
Okay, let's see here. Actually, this is another one on back pain, but we already covered back pain pretty well. We could talk more about back pain. So many times back pain can be diagnosed as a herniated disc. It could be diagnosed as facet arthropathy. There's just a whole ton of diagnoses: spondylolisthesis, spondylosis. It could be curvature of the spine. I don't really care what the diagnosis is, and I find that most patients who come in to see me have the wrong diagnosis because the diagnosis was made from an image rather than from the doctor actually touching the body and doing an examination to find the pain generator. So it's a sad case. Most doctors don't touch the body anymore. Many doctors don't even see patients anymore. They do telemedicine. I should mention this again, about a month ago I had a cardiac ablation where a catheter was injected into my groin and threaded up into the through the pulmonary vein to the atrium of the heart, and it eradicated the pathways of irregular heartbeats. Okay? So I woke up and my arrhythmia was gone. My doctor was at UCLA. His name, if you want the best guy in town, is Eric Bush, B-U-C-H. An amazingly wonderful man. I love him. And Eric Bush met me on telemedicine. So I never met him before the procedure, except when I came into the hospital that morning. He popped in to say hi. I think that's pretty amazing.
That's amazing.
Yeah, it is. And I literally fell in love with him on the internet. I thought he was very kind and informative. I didn't need to go to UCLA to meet him. I didn't need to spend 3 hours driving and parking, and waiting around. And doctors are busy. You got to wait usually. So, yeah, I think telemedicine is a great thing, But at the same time, in musculoskeletal medicine, I think it's a travesty. Hang with us, and I'll get into this more after the break. Call the office at 800-300-9300. You get a free copy of my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. And we'll send that out to you for free, and I'll pay the postage.
And we'll be right back.
You're listening to Living Pain-Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.